everyone, it's your good friend Wendy, and you're listening to the Reaching Out with Reach podcast. This is the show that brings you discussions and topics surrounding our community, prevention, and recovery. For this episode, we have our very own Brenna. Brenna, take it away.
Hi, my name is Brenna Baugh. I'm a peer recovery specialist with the YRC program at Reach Council. Last month was June, so I hope everyone had a great Pride Month, as well as a happy 4th of July. In honor of Pride Month that just passed, today our podcast will be discussing an important topic that affects the LGBTQ plus community, which is substance use and mental health. Unfortunately, LGBTQ plus youth are at a higher risk of experiencing substance use and mental health issues due to various factors such as discrimination, bullying, social stigma, and social isolation. The mental health and well-being of LGBTQ plus youth has been a topic of concern for years. Unfortunately, studies show that LGBTQ plus youth are disproportionately affected by substance use, suicide, and poor mental health. They also face a greater risk of harassment and violence. As a result of these and other stressors, these sexual minorities are at an increased risk for various behavioral health issues. The statistics are alarming and highlight the need for an increased support and resource for this vulnerable population. Let's take a closer look at the numbers to better understand the challenges faced by the LGBTQ plus youth population. According to a national survey by the Trevor Project, LGBTQ plus youth are more than 4 times as likely to attempt suicide compared to their heterosexual youth peers. The survey also reports that 60% of these youth who wanted mental health care in the past year were not able to get it. Furthermore, the Substance Abuse and Mental Health Services Administration, otherwise known as SAMHSA, reports that this population of individuals is also more likely to use drugs and alcohol as a coping mechanism for discrimination and the stigma that they face. A recent review on the use of tobacco products by LGBTQ plus individuals show elevated rates of smoking and the use of e-cigarettes compared to their heterosexual counterparts. According to the National Institute on Drug Abuse, transgender children and adolescents have higher levels of depression, suicidal thoughts, self-harm, and eating disorders than their non-transgender counterparts. Thus, it is particularly important that the LGBTQ plus people in substance use treatment is to be screened for other psychiatric problems, and all identifiable conditions should be treated concurrently. The Trevor Project has provided research-based prevention tools to help protect this at-risk population, which includes having at least one accepting adult can reduce the risk of a suicide attempt among LGBTQ plus young people by 40%. LGBTQ plus youth who report the presence of a trusted adult in their school have a higher level of self-esteem, and access to supportive peers is protective against anxiety and depression, including among those who lack support from their family. Research also leads us to believe that schools that offer youth the ability to participate in extracurricular activities and clubs have been found to promote positive youth development. The presence of gender and sexualities alliances has been found to significantly reduce the risk for depression and increase well-being among LGBTQ plus youth and young adults. If you or someone you know is struggling with substance use or mental health issues, there are organizations that specifically cater to the LGBTQ plus community. The Trevor Project offers crisis intervention services for this population, including a 24/7 hotline. Another great resource is the National Alliance on Mental Illness, which is NAMI. They provide education and support for individuals affected by mental illnesses. Another resource is the Substance Abuse and Mental Health Services Administration, otherwise known as SAMHSA. They provide information on treatment options for those struggling with substance use disorders and or mental illness. They also have a national helpline available 24/7 for anyone seeking information or support. Another great resource is the LGBT National Help Center, which offers free and confidential support for those in need of someone to talk to about their concerns or struggles. They also provide resources for finding local LGBTQ-friendly healthcare providers. You can reach the Trevor Project 24/7 hotline at 866-488-6688. 7386. The 24/7 line for Substance Abuse and Mental Health Services Administration, or SAMHSA, can be reached at 877-836-1526. And as always, the Suicide and Crisis Hotline can be reached 24/7 through text or phone call at 988. There is an urgent need for support and resources tailored specifically for LGBTQ+ youth. By addressing these issues head-on, we can work towards creating a safer and more inclusive environment for all young people regardless of their sexual orientation or gender identity. Again, my name is Brenna Ball. I am a peer recovery specialist with the YRC program at Reach Council. Thank you so much for listening to me speak about this podcast, and hopefully you can use these resources or provide them to someone that needs them.
Thanks for all the good resources, Brenna. Well, that about wraps up our episode. As always, if you're wondering how you can help, you can join our coalition meetings. You can also support our youth and family programs with a tax-deductible donation or food gift cards. And if you have any questions, you can email us at info@reachcouncil.org. That's info@reachcouncil.org. Or you can follow us at Reach Council on Facebook or Instagram. Thanks for listening to our show. Stay tuned for ongoing monthly podcasts from our Reach teams on all things prevention and recovery. So remember, life is full of choices, so choose happy and choose healthy. Bye.